Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to be covering acid-base imbalances. So if you're struggling with that, hopefully this will bring some insight. Now, this video is wonderful for PN, VN, RN, even NP students. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There, I have so many resources available to you. Lots of things you can sign up for, such as private tutoring session and NCLEX review sessions. If you're currently in the program and you're struggling, you have to do really well on your exams, be sure to check out my audio lessons and see if I have one that matches the subject matter of your next exam. Thank me later. All right. Almost daily, you can find me covering a variety of nursing topics across my social media platforms, TikTok, Instagram, Facebook, YouTube. My handle is the same across the board, Nexus Nursing. Without any further ado, guys, let's get started. Acid-base imbalance. First question. Okay. A patient with a history of COPD has the following arterial blood gas results. The pH is 7.32. The PaCO2 is 55, and the bicarb is 28. What are we dealing with here? Let me move this aside. Is it metabolic acidosis? Is it metabolic alkalosis? Is it respiratory acidosis? Or is it respiratory alkalosis? Again, the patient has COPD, their ABG results. The pH is 7.32. Carbon dioxide, 55. And bicarb is 28. What are we looking at here? Respiratory acidosis, very good. Now, before we even get to the numbers, the fact that that patient has COPD, that should have been enough to tell you that this patient is going through respiratory acidosis, right? They have COPD. They've got emphysema, they've got chronic bronchitis. We know they have this chronic respiratory condition where they are holding on to their CO2. CO2 within itself is what? It's acidic, right? Whenever we're talking about a respiratory condition, so if the patient, they've got COPD, they have shortness of breath, they have tachypnea, they have bradypnea, whatever we're talking about, if they're talking about something that has to do with respirations, we know the patient's going to be in respiratory. We don't know if it's acidosis. We don't know if it's alkalosis, but at least we know it's respiratory because it's got something to do with them breathing. It has something to do with their lungs. So the fact that they told us this patient has COPD, which is a respiratory condition, we should have already said in our minds, okay, respiratory. Now we just got to figure out, is it acidosis or alkalosis? When you have COPD, you're holding on to all of your CO2. CO2 is acidic, which means the patient's going to be in an acidic state. Respiratory acidosis, boom, that's it. But if you couldn't figure it out by the COPD portion, you got the numbers. Whenever you're introduced to numbers, the first thing you're always going to look at is the pH. The pH is going to give you so much information. Number one, the pH is going to tell you if you're acidic or alkalinic. That's number one. And number two, the pH is going to tell you if you're fully compensated or not. Guess what? pH is supposed to be between 7.35 to 7.45. If the pH is within that range, you have full compensation. If it's not, but one of the other ones are out of range, you have partial compensation. So let's talk about this. Let's look at pH. pH is 7.32, which means it's less than 7.35. Anything less than 7.35 is what? Acidic. So we know this patient's acidic. Now we got to figure out, is it respiratory or is it metabolic? Look at the other two numbers that's left. CO2 says 55. CO2 is supposed to be 35 to 45. That means the CO2 is high, it's increased, right? When we look at the bicarb is supposed to be 22 to 26. Bicarb is increased as well. But which one is out of range the most? CO2. So the problem is what? the CO2, respiratory acidosis. And what we see happening here, guys, bicarb, HCO3, that's the kidneys, is trying to help. That's why it's out of whack, but it's only out of whack a little bit. So we have respiratory acidosis. Guys, what kind of compensation are we looking at? Are we looking at full compensation, partial compensation? Can you guys tell me? Davida says, I'm in my first semester. I don't know why I'm even here. You'll get there. Very good, guys. Partial compensation. How do we know we're at partial compensation? The lungs are in trouble. That's why the patient's in respiratory acidosis. The only guy that can help are the kidneys. Kidneys supposed to be 22 to 26. When we look at this number, it's 28. That means the kidney's trying to help. That's why we're at partial compensation. Very good. Let's move on. You guys following me? You'll get it. It takes time. You'll catch on. All right. Which of the following conditions is most likely to cause metabolic acidosis? Would it be prolonged vomiting? Would it be diabetic ketoacidosis? Would it be hyperventilation? Or would it be excessive antacid use? Again, which of the following conditions are most likely to cause metabolic acidosis? Even if you don't know the answer, you should make an educated guess by looking at your options. Very good. Diabetic ketoacidosis. So this patient's blood sugar has gotten so high, they're now going through diabetic ketoacidosis. So now what happens is their body has either got rid of way too much bicarb, or they're producing an excess amount of acids. Okay. And so that's what we're seeing in diabetic ketoacidosis. Other conditions that can cause metabolic acidosis that you guys need to know for testing purposes: kidney failure. And here's the thing, guys, don't try to memorize because there's too much to know. You have to understand what's happening. So I'm going to walk you through the pathophysiology so you can understand and never forget. We're talking about metabolic, because so the first slide we we're talking about respiratory. Now we're not talking about the lungs anymore. We're talking about metabolic. That means we're talking about the kidneys. When we're talking about acid-base balance, there's only two organs involved, either the lungs or the kidneys. If we're talking about the lungs, we're talking about respiratory. If we're talking about the kidneys, we're talking about metabolic, okay? So metabolic acidosis. So we're talking about the kidneys. There's only two things that the kidneys can do. The kidneys can hold on to the bicarb or let it go, release bicarb. That's the only two things the kidneys can do. So if the patient is in metabolic acidosis, guess what? They're not holding on to any of their bicarb. That's why they're in an acidic state. So it makes sense if the patient's in kidney failure, that can put them in metabolic acidosis. Again, the kidneys are responsible for bicarb. So if the kidney's not working, they're not making enough bicarb, they'll throw them the opposite way. They'll throw them into acidosis. So kidney failure, that's one of the things that can cause metabolic acidosis. What else? Severe diarrhea. Why? Base out the butt. When you're pooping base. You're losing all your base. So if you don't have enough base or alkalinity, it's going to throw you the opposite way into what? Acidosis, right? And the third one, and this one's easy, lactic acidosis. Lactic acidosis will cause you to be in an acidotic state. Okay. Whenever we're talking about anything that has nothing to do with the respirations or the lungs, guys, we're talking about the kidneys, we're talking about metabolic. So let's look at the other options. Prolonged vomiting. You're throwing up all over the place. What do you think that's going to cause? It's going to cause metabolic alkalosis. Why? You have hydrochloric acid in your stomach. All of those gastric acids that's in your stomach to break down the food. If you're throwing it up, you're getting rid of all that acid. It's going to throw you the opposite way in an alkalinic state. Hyperventilation. That's our next option. I can't speak. That's our next option. So look at me. If I'm hyperventilating, look at what I'm doing. I'm blowing off all of this CO2. CO2 is what? Acidic. Duh. So what's it going to do? It's going to throw me into the opposite way. If I'm getting rid of all of my acidity, it's going to make me go into an alkalinic state. It will cause respiratory alkalosis. And last, that's easy, excessive antacid use. So you're taking all of these antacids, things that work against acid. It's going to throw you in what? A metabolic alkalosis state. Does that make sense to you guys? Okay. Let's keep going. All right. A patient with severe diarrhea is at risk for which acid-base imbalance? Oh, you better be lucky. I just gave you the answer in my last explanation. Do not play with me. Respiratory acidosis, respiratory alkalosis, metabolic acidosis, or metabolic alkalosis. Everybody should get this correct. I need to stop sipping on this cremas because I might not even make it to the end of this video. I said I was going to stop, but it's been a long day. Yes, the Kahoots are posted on my YouTube channel when we're done. Very good. Very good. But I need to know how 50 of you guys still chose metabolic alkalosis. When I told you base comes out the butt. Base out the butt. If you're losing base, it's going to throw you in the opposite way. It's going to throw you in the what? Acidic state. This is important, guys. You can't forget that. All right, metabolic acidosis. Your patient's experiencing hyperventilation. Oh my gosh. Which imbalance is most likely present? I gave you guys the answer for this too. Everybody better get it right. Metabolic acidosis, metabolic alkalosis, respiratory acidosis, or respiratory alkalosis. Come on, people. Your patient's hyperventilating. What is happening? I need you to think through what's happening. The pathophysiology. You guys are doing great on the live. Very good. This is not a select all that applies. Very good. Respiratory alkalosis. You're blowing off all that CO2. Carbon dioxide, also known as what? Carbon diacid, because it's so acidic. So you're getting rid of all your acid and it throws you in an alkalinic state. And we're talking about something that has to do with breathing, so we know it's respiratory. Respiratory alkalosis. All right. Which intervention is most important for the patient with metabolic acidosis due to diabetic ketoacidosis? Is it to administer sodium bicarb? Is it to encourage slow, deep breathing? Is it to administer IV regular insulin? Or are you going to restrict fluids? What are you going to do? Your patient has metabolic acidosis due to diabetic ketoacidosis. What's going to be your nursing intervention? Very good. You're going to give IV insulin. That is a correct answer. So here's the thing. In the question where they tell you patient has metabolic acidosis, okay, due to whatever comes after that due to, and this goes out for all nursing questions, whatever comes after due to, that's your real problem. That's what you're attacking, okay? So when you're taking these nursing exams, it's going to be something else. Whatever comes after that due to, that is what you're going to attack. This patient's having metabolic acidosis, but it's due to what? Diabetic ketoacidosis. What are you going to do? You're going to give them IV insulin. Insulin is going to push glucose back into the cells, and it's going to stop that ketone production. Okay, I see 41 of you guys chose administer sodium bicarb. We don't do that unless it's severe and we've given the insulin first. The first thing you're going to do is give the insulin. We're going to try to push that glucose into the cell. We're going to try to stop that ketone production. Now, after that, and it hasn't worked, this patient is still in a severe state, then you'd expect to administer sodium bicarb, but that's not the first thing you're going to do. 6 people said encourage slow, deep breathing. I'm going to give you a visual. And I need the 6 people who chose this as an answer. Tell me if you're still going to choose this as your answer. Your patient is in metabolic acidosis. They are in an acidic state. They have way too much acidosis. And you're telling me your solution to that patient is for them to breathe slower, which means they're going to hold on to their CO2. They're going to hold on to their carbon dioxide. They're going to hold on to their carbon diacid because remember, CO2 is what? Acidic. This patient is already in acidic state, and your idea is to make them breathe slower to hold on to either more acid, to hold on to even more acid. Are we in the business of killing patients? Absolutely not. So we're not going to do that. We're not trying to get them to hold on to the CO2. They've got way too much acid to begin with. So we're not going to do that. And last, restrict fluids. I'm happy only 4 of you guys chose this. Let me explain to you what happens in DKA. Besides that patient's ketones being increased, besides that patient being in an acidotic state, what happens is the sugar's so high, the body tries to compensate. And so they're going to go through polyuria, polydipsia, polyphagia. What's the first thing I said? Polyuria. They're going to be urinating all over the place. Why? Their body's trying to get rid of all that glucose via urine. They're urinating all over the place. They're losing fluids and electrolytes. This patient is at serious risk for dehydration. Your bright idea is to restrict their fluids? Absolutely not. If anything, we're giving that patient fluids, right? Because they're at risk for dehydration. You guys with me on the live? All right, let's keep going. All right, your patient, the pH is 7.5, a CO2 30. They're experiencing which acid-base balance? And I only gave you 2. You could answer this with only 2 of them. I didn't even give you the HCO3. What's this patient going through? Metabolic acidosis, respiratory alkalosis, metabolic alkalosis, respiratory acidosis. What are they going through? The pH is 7.5, CO2 30. Respiratory alkalosis. Guys, the name of the game, what the lungs slash CO2 and the kidneys slash HCO3, everything that they're doing is to get the pH between 7.35 to 7.45. That is the whole name of the game. That's why they're moving around, to get that pH between 7.35 to 7.45. So the first thing you're always going to do is look at that pH. When we look at that pH is supposed to be 7.35 to 7.45. We're dealing with 7.5. Anything higher than 7.45 is alkalosis. So we know for sure the patient is in an alkalotic state, basic state. The only other one I gave you was CO2, and it says CO2 30. Well, normal CO2 is 35 to 45. This is out of the range. So we know who's in trouble. The lungs, respiratory alkalosis. When you guys are given three numbers, you're given the pH, you're given the bicarb, the HCO3, and you're given the carbon dioxide, which is a CO2. Between the carbon dioxide and the bicarb, between those two, if both of those are out of range and you need to figure out what you're dealing with, look to see which one is out of range more. Whichever one's out of range the most, that's the one that's suffering the most. Okay? So that means if CO2 is out of range the most, that patient's going through respiratory whatever. And even if out of the bicarb was out of range, but it's not as out of range as the CO2, guess what? It still would be respiratory whatever, and then it would just be partial compensation because the bicarb is trying to help. Does that make sense? That's right. Rome method. ROME. Respiratory if the sign's opposite. Metabolic if it's equal to the pH. I love the Rome method, but I also like the tic-tac-toe method. But whatever works for you, use it. All right. A nurse is caring for a patient vomiting for 3 days. What acid-base balance is expected? Vomiting for 3 days. What do you expect that patient's going through? Metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. Come on, some of you guys are making me nervous. Think about what's happening in the body here. Very good. Metabolic alkalosis. We know it's metabolic because it has nothing to do with the lungs. They didn't mention any shortness of breath. They didn't mention any hyperventilation. They didn't mention tachypnea, nothing. So we know we're talking about metabolic. Now we need to know, is it acidosis or is it alkalosis? And then we remembered, if the patient's vomiting, what are they vomiting? They're vomiting whatever's in their stomach. What's in their stomach? Hydrochloric acid. Acid that's supposed to break down food, gastric acid. So if they're getting rid of all of that gastric acid, how are they going to be in an acidic state? No, if they're getting rid of all that acid, it's going to throw them on the opposite end. They're going to be in an alkalinic state, metabolic alkalosis. A patient with renal failure presents with these ABGs. The pH is 7.28, the bicarb is 18, the CO2 is 38. What's going on here? Respiratory acidosis, metabolic alkalosis, respiratory alkalosis. Guys, you can't escape this because you see this for your PNVN boards, you see this for your RN boards, and guess what? You see this again when you want to be a nurse practitioner. You cannot escape it. And I'm talking about for both of those state exams, whether you're taking ANCC or AANP. If you're taking fundamentals of nursing right now, I'm telling you, your instructor is going to kill you with these type of questions. So don't think, oh, well, I can't understand it. I'll just miss that one question. No, you're going to get a lot of questions on these. Make sure you know it. Don't say I didn't warn you. Very good. Metabolic acidosis. How do we know? The first thing, matter of fact, forget the numbers. Let's not even get to the numbers yet. Let's look at that patient's condition. Renal failure. Renal failure. Who's in trouble? The kidneys. So what are we dealing with? Metabolic. That alone, renal failure, we know that we're dealing with metabolic because it has nothing to do with the lungs, right? Right. Okay. Let's keep going. Renal failure. The kidneys have failed. They're not working. What are the kidneys responsible for? The kidneys are responsible for making what? Bicarb, alkalosis, making the patient basic. So if the kidneys that's responsible for making the patient be in alkalosis is not working, what are they going to be in? Acidosis, boom, metabolic acidosis. Before we even looked at the numbers, just seeing renal failure, we already figured out what that patient's going through. Now we can confirm our suspicions. Look at the pH. Again, pH is supposed to be between 7.35 to 7.45. Anything less than 7.35, you're dealing with acidosis. They're at 7.28, so that means they're in an acidotic state. Acidosis, for sure. Now we got to figure out, is it metabolic or is it respiratory? Let's look at our other two. Bicarb is supposed to be 22 to 26, but bicarb is 18. Excuse me, I count on my fingers because I can't do it in my head. 18, 19, 20, 21, 22, 23, 24, 25. That is 8 points off from the norm. All right. Let's look at CO2. CO2 is supposed to be 35 to 45, and it's 38. CO2, I'm saying CO2. Yeah, CO2 is normal. So we know for sure the patient's going through metabolic acidosis. Now, my question to you, compensation, full compensation, partial compensation, no compensation, what's going on? You guys tell me. What's going on with compensation, guys? Very good. Most of you guys got it. If you don't stop, no compensation. There's absolutely no compensation happening. How do we know that? This patient's going through metabolic acidosis. The kidneys are in trouble. The only guy that can help are the lungs. Look at what the lungs are doing. CO2 is supposed to be between 35 and 45, and the CO2 is 38. It's within normal limits. What does that tell us? That means the lungs are not fighting to help the kidneys at all. The lungs are in the cut chilling, watching the kidneys struggle and fight for their life. Because if the lungs were trying to help, the lungs would have been out of range. But the lungs are within normal range. CO2 is right there within normal range. CO2 is not doing anything to help the kidneys. So what we're dealing with is metabolic acidosis, absolutely no compensation whatsoever. All right, a patient in the ICU is diagnosed with respiratory acidosis. What symptom would you expect to see? Increased respiratory rate, confusion, numbness and tingling, or seizures? Your patient that's in the ICU is diagnosed with respiratory acidosis. What clinical manifestations would you expect to be exhibited by this particular patient? I need some of you guys to think about your answers. A lot of you guys are correct. Very good. But some of you are off the wall with it. Think about it. Wow. 61 of you guys went with increased respiratory. Okay, let's talk about the right answer first, and I'm going to go with your hot mess answers that you guys went with. Let's talk about the right answer first. So, your patient has respiratory acidosis. They're in the acidic state. Let me tell you something. Respiratory acidosis, respiratory lungs, acidosis. They got way too much acid, which means they're holding on to way too much what? CO2. That's the only thing the lungs are responsible for. The lungs can either make you blow off CO2 or make you hold on to CO2. If your breathing slows down, you're going to hold on to CO2, and if your breathing speeds up, you're going to blow off CO2. So this patient is already in respiratory acidosis. They're holding on to too much CO2. What clinical manifestations are we going to expect? CNS depression. CO2 retention causes CNS depression, confusion, lethargy, disorientation, drowsiness, That decrease in their level of consciousness. That's what we expect to see. Now, for the 61 of you hot messes that decided to go with increased respiratory rate, your patient is in the ICU with respiratory acidosis. They're holding on to all that CO2. Don't you think we're going to be controlling those respirations to help them? How are we going to see that patient how are we going to see that patient with increased respiratory rate? The question is asking, what is the clinical manifestation? What do you expect to see in this patient that already has this condition? Now, I know what you guys were thinking. What's the compensatory mechanism of respiratory acidosis? If I asked you that question, you'd be correct. If the patient's in respiratory acidosis, they're holding on to way too much CO2. What are the lungs going to do to try to get rid of it? Blow off that CO2. But that's not what I asked you. I asked you what symptom you expect to see from that patient. Big difference. Okay, we would expect to see CNS depression because of that CO2 retention. This is very important. I promise you're going to be tested on this. You better remember me yelling at you now so you can get it right on your test. All right, a patient's in metabolic alkalosis. Which treatment is appropriate? Are you going to administer potassium chloride? Are you going to encourage deep breathing? Are you going to administer sodium bicarb? Are you going to place that patient in Trendelenburg's position? Excuse me. Hannah, I'm going to fight you. You better change your answer. Right here, Hannah. I feel like you guys are messing with my nerves on purpose. You're going to administer potassium chloride, guys. A patient's in metabolic alkalosis. What treatment is going to be appropriate? Potassium chloride. Why potassium chloride? Hypokalemia is one of the most common causes of metabolic alkalosis. Give them potassium chloride. They are getting on my nerves on purpose. All right. pH 7.36, CO2 50, bicarb 30. What's happening? Uncompensated respiratory acidosis, fully compensated respiratory acidosis, uncompensated metabolic acidosis, or partially compensated respiratory acidosis. You remember before we started this live, I told you guys to grab a pen and paper, and I gave you those hints, I gave you those clues to figure out what's happening with the patient. You wish you listened to me now, don't you? What's happening with the patient? Big C says I wasn't here for the notes. All right, most of you guys got it right. Very good. Fully compensated respiratory acidosis. How do we know it's fully compensated? By the pH. That is the first thing you look at every single time. If that pH is within 7.35 to 7.45, you have full compensation. So pH is 7.36. It's within that range, fully compensated. Now we just got to figure out, is it respiratory, metabolic, acidosis, alkalosis? Well, let's take a look. CO2 is supposed to be 35 to 45, and it's 50, so it's 5 points off. Bicarb is supposed to be 22 to 26, and it's 30. So it's 4 points. We are 26%. Yeah, it's 4 points off. So who's in trouble? The lungs. Lungs responsible for what? CO2. Respiratory. We know we're dealing with respiratory. How do we know if it's acidosis or alkalosis? Hello? CO2 35 to 45. We have way more CO2 than we're supposed to. And CO2 within itself is what? Acidic. So we know we're dealing with respiratory acidosis. Now, when we look at bicarb. We know we have respiratory acidosis, and we look at bicarb. Bicarb is out of range. Why is it out of range? Because it's trying to help the lungs. The lungs are in trouble because remember, the lungs are 5 points off where bicarb was only 4. That's how we know that it's the lungs that's truly in trouble and it's bicarb that's trying to help. The patient's in respiratory acidosis. The lungs are in trouble and the bicarb's trying to help because if it wasn't trying to help, bicarb would have been between 22 and 26. It would have been normal. But because it's outside of the range, that's how we know it's trying to help. And guess what? It did help because when we look at that pH is between 7.35 and 7.45. Baby, that is fully compensated. Can't get better than that. Okay? All right. Don't let these questions fool you. You just have to think through what's happening with the patient. We got one more, and then we're done. A patient has respiratory alkalosis. What is an appropriate intervention? Encourage slow, deep breathing, administer oxygen, administer sodium bicarbonate, or place the patient in high Fowler's position. Patient has respiratory alkalosis. What is an appropriate intervention? Very good. Encourage slow, deep breathing. The lungs are in trouble. There's not enough CO2. We need more CO2. So what are we going to do? Slow down the breathing to keep the CO2 because remember, CO2 is acidic. Very, very, very good. People who said the 14 of you who said administer oxygen. Since slide 1 to this slide, have you heard me mention oxygen at all? In this entire teaching, in this entire lecture, this entire activity, have you heard me say that word oxygen to you at all? Okay. And you know it's not sodium bicarbonate. The patient's already in an alkalinic state for the 5 of you that chose sodium bicarb. They already got too much bicarb. We're not going to do that. And 10 of you guys chose place patient high Fowlers. Let me tell you when we place a patient high Fowlers. When they cannot breathe and we want them to get more oxygen into their lungs, we're going to sit them up. We want to push down the diaphragm. We want the lungs to expand. But in this case, the patient, they're in an alkalinic state and we need them to hold on to their CO2, right? So we're going to slow down their breathing so they hold on to their CO2 instead of breathe it out. All right. So for the last time, guys, I encourage you, if you're studying for your boards, make sure you know this well because you may get a couple questions on this. You can't run from it. Just study it, understand it. I've got lots of videos in my Fundamentals of Nursing playlist. You'll see lots of videos on acid-base balance. You can practice with me if you need the help. All right, guys, let's see how you did.